Hi friend, this is Dr. Apurv Mehra. This video, in first 32 minutes, will cover 180 images. In next 4 minutes and 28 seconds, we'll talk about the MCQ asked in the recent exams. And the last 2 minutes, your friend will give a message from the heart. Get glued to your seats, mind and eyes on the screen. Let's start rolling. Thank you very much. X-rays will show you the bone, but will also show you the soft tissue planes, the muscle and the fat. Will not show you cartilage, which is called as a joint space. And that is why when the cartilage gets destroyed, the joint space gets reduced, which is a sign of damage to the cartilage called as arthritis. When you look at the shoulder, remember the clavicle is the highest point, but they love to talk about the coracoid. When they look at the elbow, they just love to ask you, pointing an arrow here, what bone is this? Answer is capitulum. Remember that in the wrist, they love to talk about the ossification, but the border bone is the radius. On it, scaphoid sleeps, which ossifies at the age of 5. She looks too pretty. She looks too pretty. Try to catch her. 5 years, 4 years, 3 years, total it out, 12 years is for pisiform. Trapezium, trapezoid, 5 years, 5 years. Capitate, the first carpal bone, and the hamate again the first year. But the first one to ossify is capitate. Total again is 12. Shoulder, coracoid, elbow, capitulum, wrist, capitate. Remember that the C in upper limbs. When you look at the images on the lateral view of the wrist, remember the first metacarpal is anterior. And it is the moon, which is called the lunate shaped bone, which is on the center over the radius. In the pelvis, the sacroiliac joint inflammation, sacroiliitis, is seen in ankylosing spondylitis. Young man with low back ache, sacroiliitis, reduced chest expansion, think about ankylosing spondylitis. That's how sacroiliitis will look to you. When you look at the pelvis, the arch that forms the upper end of femur and the pubic rami, if it is broken, it means there's a dislocation or the fractures either involving the femur upper end or the pubic rami. When you look at the calcification, CT scan will show you occult or small calcifications, but orthopedic world is ruled by MRI, which will show you the marrow, the cartilage and the soft tissue. M for MRI, M for marrow. Most of the diseases in orthopedics are in the marrow, so it's a good investigation to pick, most importantly, infections and tumors. Remember, when you do a sagittal cut of the knee MRI, you see 2 ligaments, one going anteriorly on the tibia, the ACL, which restricts the hyperextension and interrotation of the knee, and the posterior most structure on the upper end tibia, the PCL, which restricts the external rotation. CT scan is white, MRI is dark, remember this. Remember, when there is a destruction of the bone, there is a periosseal reaction. Small destruction, single layer, solid periosseal reaction. Rapid destruction, multiple layers, wide periosseal reaction. Wide zone or wide reaction is seen in Codman's triangle, a triangular piece of bone underneath the periosteum. Can be seen in any malignant bone tumor, usually osteosarcoma. Multiple rays coming out, the sun ray appearance. Any malignant bone tumor, usually osteosarcoma, or multiple layers over the bone like an onion peel, seen in any malignant bone tumor, usually Ewing sarcoma. So wide zone indicates chronic or malignant process, but the diagnostic for any infection or tumors is always the tissue diagnosis. Solid reaction, osteomyelitis day 7 to day 10. Wide zone, sun ray appearance, any malignant tumor, usually osteosarcoma. Codman's triangle, any malignant tumor, usually osteosarcoma. Onion peel appearance, any malignant tumor, usually Ewing's. Remember, sun ray or Codman's triangle, osteosarcoma. Onion peel, Ewing sarcoma. So bubble appearance, like the destruction of the bone till the joint, osteoclastoma more than adamantinoma. Calcified tissues are cartilaginous. Chondrosarcoma more than chondroblastoma. Chondrosarcoma is a calcified tissue upper and femur, very commonly asked. Uniform calcified tissue in the metaphysis of the bone, osteosarcoma. This is cartilaginous tumors. This is how the uniform calcification of osteosarcoma appears. And this is the only tumor that can go till the joint is the joint cell tumor, most commonly seen in lower end femur, but classically seen in the lower end radius. In fact, the tumor of lower end radius is GCT TPO, till proved otherwise. When you look at the infections, remember the organism Staph aureus, acute Staph aureus, subacute Staph aureus, chronic Staph aureus, but the chronic infection is diagnosed by a dead bone called as sequestrum. Sequestrum is in the cavity, filled up with granulation tissue. Surrounding bone on the sequestrum is called as involucrum, the reactive bone. The discharging sinuses are called as cloacae, and from these discharging sinuses, sometimes the bony spicules can be discharged. These are called as the sequestrum. Again, a recent question. Remember, chronic infections will lead to deformed white bone. In chronic infections, the rim is formed by the involucrum called the rim soin on MRI. When you want to cover with a soft tissue, the chronic infections, this is called as the machine negative pressure wound therapy or vacuum assisted closure. An image comes in the exam. Infections of the hand are common. Organism is Staph aureus. Most common infection of hand is paronychia, the infection of the nail bed. Then you have the phelon or whitlow, which is the infection of the pulse space, and then you have the infection of the flexor tendon sheath called as infectious tenosynovitis. Tuberculosis will always affect the two contiguous vertebrae. It's a disease which is anterior. It's also called as a paradiscal disease. It will rarely involve the posterior elements. Remember, TB hip most commonly involve the acetabulum. After acetabulum, the second common site for TB hip is the proximal end of femur called as the femoral head. The triangular area here called as the Babcock's triangle. Remember that when you want to replace any joint, there can be two ways. You can replace it along with the cement, which is polymethyl methacrylate, or uncemented, which is costlier and stronger construct. Remember, when you compare a bone to the x-rays, remember that the physis or the growth plate is made of cartilage, will not be seen on x-rays. Also remember, the epiphysis and the metaphysis are upper end. Diaphysis is the middle of a bone. Diaphyseal lesion, remember Ewing's sarcoma. Diaphyseal, remember osteoid osteoma. Remember adamantinoma. Whereas the metaphysis is the most common location for infections and tumors. When you look at a single cavity in the upper end of humerus, think about unicameral bone cyst, and sometimes they have a small fragment at the bottom called as the fallen reef sign. When there is a segment of a bone where multiple septae are there towards the corner, it's called as multiloculated eccentric, seen in aneurysmal bone cyst. When you have the epiphyseal lesion along with the calcification, it's called as a Codman's tumor. It's a chondroblastoma. When you have a bony growth away from the bone going down, covered with the cartilage, is called an osteochondroma. Remember, it's a developmental abnormality. When you touch the bone, you will feel it. When you touch the cartilage, you feel it. When you click the X-ray, you don't see the cartilage. So large to feel small on X-rays. They have malignant transformation into chondrosarcomas, but the risk is always less than 1%. Osteoid osteoma is a radio-dense collection in the diaphysis. They have classical night pain relieved on taking salicylates, and the growing center is called as a nidus. Remember, enchondroma is the most common tumor of bones of hand, right? And it is filled with the cartilage. Remember, when there are multiple enchondromas with hemangiomas, with calcified veins, it's called as Maffucci syndrome. And when you have only multiple enchondromas in the body, it's called as a Ollier syndrome. When you look at the GCT, classical, lower end femur, but the other sites are the lower end of radius, which I told you, tumor of lower end radius is GCT, till proved otherwise. It can go at the upper end of tibia or upper end femur. All these images have come. It's the only tumor which can go close to the cartilage or up to 1.5 centimeter of the cartilage. When the upper end of femur changes the shape like a stick of a shepherd, it's called as a shepherd crook deformity. Disease is fibrous dysplasia. Vertical striations, also called as corduroy appearance in a vertebra, are seen in hemangioma. Remember, osteosarcoma is an ossified tissue which is homogeneous, most commonly second decade of life, metaphyseal. Commonest site, lower end femur. Lower end femur, three things are commonest: osteomyelitis, GCT, osteosarcoma. Many a time they give you a specimen, pathology specimen, with the destruction of the metaphyseals with raised periosteum. That's the feature of osteosarcoma. Remember, skull lytic lesions are very common. Punched out lytic lesions in skull is characteristic of a plasma cell destruction of the bone called as multiple myeloma. These are the skulls. If you have a beveled or sloping skull margins, it's called as eosinophilic granuloma. When you have punched out lytic lesions, it's seen in multiple myeloma. When you have permeative or large lytic lesion, it's seen in Langerhans cell histiocytosis. Salt pepper skull is seen in hyperparathyroidism, right? And when you have calcified skull, where you have more deposit, osteosclerotic deposit, it's seen in Paget's disease, which is an increased bone turnover. Remember the autonomous zones. The tip of index finger is supplied by median nerve, the tip of little finger by ulnar nerve, and the dorsum of the first, the radial nerve. Remember the important nerves around the shoulder axillary, around the humerus radial nerve, behind the medial epicondyle, very commonly as ulnar nerve, at the head of radius, posterior interosseous nerve, the branch of radial nerve. Around the hip, posteriorly sciatic nerve, around the knee, neck of fibula, the common peroneal nerve. Also remember, the lumbricals, they make a L in your hand, L for lumbricals, flex the MCP and extend the interphalangeal joint. Loss of the function of lumbricals causes the claw hand, which is corrected again by the knuckle bender splint, right? For ulnar nerve, the test, they are palmar interosseous, they will adduct. So if you give a card to the patient, if he holds it between the fingers, this is called a card test, palmar interosseous. If you give a book to the patient and he holds it between the thumb and the palm, it's called as a book test, adductor pollicis, again for ulnar nerve. If the ulnar nerve is paralyzed, you flex the thumb and hold it. This is called as a Froment sign. Then remember, for the median nerve, if you make a fist, right, this is called as a normal median nerve. And if the median nerve palsy is there, these two fingers will stand out, called as the pointing index. This is also called as the Pope sign, because of the benediction attitude. Or if you ask the person to clasp his fingers, and if one of them stays out, is Ochsner clasp test. The branch of a median nerve, the anterior interosseous nerve, is responsible for this O sign or Kilo-Nevin sign, because anterior interosseous nerve supplies the flexor pollicis longus and the anterior interosseous nerve supplies the FDP lateral half. That's all anterior interosseous nerve supplies. This is what the claw hand does. If the median nerve is paralyzed, you have a median claw hand. Ulnar nerve is paralyzed, you have ulnar claw hand. Both are paralyzed, total claw hand, corrected by a splint called as knuckle bender splint. Since the ulnar nerve palsy is more common, ulnar nerve more than median nerve. Remember that Waiter tip deformity is a classical of Erb's palsy, which is there in C5 and C6 nerve roots. So there is loss of abduction at shoulder, external rotation of shoulder, flexion of elbow. So these are the movements which are lost. Supination is lost, so the arm is by the side of the body. Remember, the radial nerve is the most commonly paralyzed nerve in human body. Palsy of a radial nerve will cause a wrist drop, and opposite to it, you will extend the wrist, called as a cocker splint. Again, an image comes. When the nerves are compressed, they are called as compression neuropathies. Most commonly median nerve at the carpal tunnel, and one of the sign is a Fallon sign for carpal tunnel syndrome. This is a reverse Fallon sign, and if you directly compress the carpal tunnel, it's called as Durkin's direct compression test, the most specific for a carpal tunnel. So this is what I told you, wrist drop occurs in fractures of humerus, cock-up splint for the radial nerve palsy. When I look at the thoracic outlet syndrome, the compression of the C8 and T1 nerve roots, more importantly T1 nerve roots around the shoulder and the neck, right? So when you do close and open this hand for about 3 minutes, you will feel the numbness along the C8 and T1 distribution of the nerve. This is called as a Roos test. right? So there are other tests also, the Adson's test and Rice test. They all mean the pulsation, the radial artery pulsations become feeble. And when you want to find out the patency of the radial artery in the hand, then you do the Allen's test for the same. When you look at the trauma, shoulder dislocation, the most common dislocation in the human body is usually anterior. The head is beneath the coracoid called as subcoracoid, and the head is lower than the shoulder, and the arm is abducted called as down and out. In the shoulder dislocation, anterior or inferior, most commonly damaged nerve is the axillary nerve. And the methods to reduce the shoulder dislocation are Coker's, the Stimsons, and the Hippocrates. The carrying angle is the angle between the arm and forearm. It's more in females. When the carrying angle increases beyond normal, it's called as cubitus valgus. And when it's reduced, it's called as a cubitus varus, also called as gunstock deformity. Fractures of the forearm with dislocations are very common. Fracture of ulna with dislocation of radial head is called as a Monteggia fracture dislocation. And the opposite of it is Galeazzi fracture of radius with dislocation of distal radial joint is more common. That's why more commonly asked in the exam. Fractures around the wrist. Colles fracture is a fracture of the lower end radius with the dorsal displacement of the fragment, and the Smith fracture is the extraarticular fracture of lower end radius with the volar displacement. Both are extraarticular. It is a directional displacement which decides what it is. So Colles will cause a dinner fork deformity, and the Smith fracture is known to cause a garden spade deformity, opposite of it. And when you look at the blood supply of the scaphoid, it is distal to proximal. That is why in the fractures of the scaphoid, which occurs from the center, called as the waist, there is an avascular necrosis involving the proximal pole. This is how you have to pick up the scaphoid fracture image. Many times they ask you, and the dead bone looks more white. That's how you look at it. When you look at the fractures of the base of first metacarpal, Bennett's is a fracture of base of first metacarpal with a dislocation. And Rolando is only a fracture of base of first metacarpal without a dislocation. Both, mind you, are intra-articular. And when there's a wrist dislocation, remember, if only the lunate comes out, it's called as a lunate dislocation. And when the lunate stays in and all the other bones comes out, it's called as a perilunate dislocation. Perilunate is more common. And around the wrist, the median nerve is most commonly damaged. When you look at the lateral curvature of spine, it's called as scoliosis, and the angle for it is Cobb's angle. And the test for it, you ask the patient to forward flex, and if the scoliosis disappear, it means it's a positional, and if it persists, it means a structural deformity. If there is an anomaly, it's called as congenital scoliosis, otherwise it's idiopathic. That's what I was talking about. The Cobb's angle can decide the treatment. Usually the scoliosis is treated with a brace up to 45 degrees of angle, and if the angle is more than 45, you operate. The braces are the Milwaukee or the Boston brace, and you do it more for lower dorsal spine than lumbar spine. Trendelenburg test talks about the stability of the hip joint, and it talks about the intact acetabulum, the intact femoral head, the intact neck, and then the abductor mechanism, gluteus medius and minimus, and their superior, and the nerve supply, the superior gluteal nerve. When you bear a weight on the affected side, the opposite side drop is a positive Trendelenburg test. So drop on the opposite side of pelvis is a positive test. So if my left side here is affected, so the right side will drop, it's a positive test. Thomas test is for hip flexion deformity. Some common fractures. Jefferson's is a fracture of atlas. It is a vertical compression injury where comminuted fracture occurs. Hangman is a slip fracture of C2 over C3. It's a slip of one vertebra over the other called as spondylolisthesis. Clay-Shawler's fracture is the fracture of lower cervical and upper thoracic spinous process. If you have to choose one, C7 spinous process is the commonest. And when you look at the upper and femur, according to the areas of weight bearing, the trabeculae are more dense. This is the Wolff's law. When the fracture occurs to the neck, it's called as the neck of femur. And when it occurs to the intertrochanteric area, it's an intertrochanteric fracture. Remember, fracture neck femur will have shortening and external whereas intertrochanteric will have marked shortening, marked external rotation. The treatment for intertrochanteric fracture, you put a nail and fix the fracture with a screw called as proximal femoral nail. And for the treatment for the neck femur, less than 65 years, you usually treat with screws. More than that, you replace. Hemiarthroplasty is the usual treatment. Proximal humerus fractures are usually classified by the needs classification, where the number of fragments will decide the classification. When you look at the fractures of the lower end of humerus in a child, just above the condyles is the supracondylar fracture humerus, which usually displaces posteriorly and medially. It's called as a posteromedial or extension type of injury. It's a very common injury in a child, usually treated by a cast and reduction or a reduction along with a K-wire. So this is what I told you. Montagia is a fracture of ulna with a dislocated radial head. Galeazzi is a fracture of radius with damage to the distal radioulnar joint, the interosseous membrane, and the triangular fibrocartilage at the wrist joint. Nightstick fracture is an isolated fracture of the ulna. Colles fracture is an extra-articular fracture of radius with a dorsal displacement. Schauffers fracture is involving the fractures of the radial styloid. Boxer's fracture is the fracture of the neck of the fifth metacarpal occurring in the boxers. Then you have the pelvic fractures. If the pelvis opens up, right, anteriorly, damage to the anterior side and opposite side posteriorly, so it's called as a bucket handle fracture, anteriorly on one side, posteriorly opposite. When the pelvis opens up hinging on the posterior elements, it's called as an open book fracture. So hinging on the posterior elements, the anterior elements open up. And when there's a fracture anterior and posterior involving on the same side, it's called as a Melgagne fracture, which came in the JIPMER recent exam. Straddle fractures is superior inferior pubic rami anteriorly. Bumper fracture is a fracture of the lateral tibial plateau. Pylon fracture is a fracture which involves the lower end of tibia comminuted involving till the joint, intra-articular comminution. And when there's a fracture of the medial malleus, the lateral malleus, and the posterior malleus, all the three malleus, it's called as a Cotton's fracture. And when there's a fracture involving the medial malleus and the lateral malleus, it's called as a Potts fracture. Aviator's fracture occurs due to vertical injuries, is a fracture of the neck of talus. And when there is a damage to the intertarsal area, it's called as a Chopard's injury. And when there's a damage to the tarsometatarsal area, it's called as a Lisfrank's injury. When you look at the Jones and pseudo-Jones, remember Jones fracture is a little distal, whereas pseudo-Jones fracture occurs at the tip of the fifth metatarsal base. And when you look at the March fracture, it involves the second and the third metatarsal neck more than the shaft. And clavicle, the braces, figure of 8 bandage, which is for the clavicle fractures. This image can come. The U slab is for the humerus fractures, or a hanging cast is for humerus fractures. H for hanging, H for humerus. Dunlop or Smith traction is for supracondylar fracture humerus. Hand shaking cast is for Colles fracture. Glass holding cast is for scaphoid fracture. Mallet finger is avulsion of extensor tendon from distal phalanx. Mallet finger splint is applied for it. Milwaukee brace is involving the trunk for scoliosis. Cylinder cast is for the fractures of the patella. PTB, patellar tendon bearing cast, is for the fractures involving the tibia. And you allow weight bearing in this cast when there is a formation of the soft callus, that is, it is a little deformable but not displaceable. And Bola-Blom splint is used for giving tractions in the lower limb, for the femur, for the knee, or for the tibia. Tension band wiring is done for the fractures of patella. Fracture patella images are very commonly shown to you. When you give traction to the bone is a skeletal traction. You can give up to 20 kgs, and skin traction when you give to the skin 3 to 4 kgs. When you fix a bone with a plate, this is a classical plate called the dynamic compression plate. When the surface area becomes less and there are grooves for the blood supply to come in, it's called as the limited contact dynamic compression plate, LCDCP. And when you have the screws for it, the cortical screws for the cortical bones, the cancellous screw for the cancellous bone, and then there are screws over the head which has got a thread. It is for the locking plates, where the screw will go inside the plate and will lock it so that the construct is very strong, cannot come out. When you put a nail, it's called as interlocking nail, because with the screws you lock the nail to the bone so that there is no rotational malalignment. When there's an open injury, you can't plate or nail, you will put an external fixator, and some type of other external fixators are rail fixators or the Ilizarov fixator, which are given to you. The Ilizarov external fixator will allow the lengthening of a bone at a rate of 1 millimeter per day. And then some instruments you must know: osteotome to cut the bone, then you have the bone cutter, then you have a bone nibbler, a very common instrument asked. You have a curette to clean the cavities, or you have the bone holding forceps. Anything which is a tooth will hold the bone. So all these are bone holding forceps. If on one surface you have tooth and on another you don't, it is a bone plate holding surface. So these are the important things. When you look at the arthritis setting in the hand, if you point the finger towards anybody and the two joints that point towards him, the DIP and PIP, both are involved in OA. You say OA. And when you call towards you, RA means towards you. The PIP and MCP, they are towards you, are involved in RA. Remember, the base of the first carpometacarpal joint is involved in OA, very classical, and the wrist is involved in RA. Remember that. You must also remember RA will involve the upper cervical spine, right? And when there is an osteoarthritis, remember knee is also a common joint. DIP is the commonest. Knee is also the common joint, and there will be reduced joint space. Just beneath the joint, there will be sclerosis. Age-related disorders will cause sclerosis, called as subchondral sclerosis. And for that, if the patient is less than 60 and the deformity is, yes, you do a high table osteotomy. But if the patient has more than 60, you will replace it, called as total knee replacement. For RA, you have a deformity in the fingers. Middle-aged female or young female with bilateral hindpin with morning stiffness is RA. You can have a swan neck deformity in RA, or you can have a bottom leg deformity. Swan neck or bottom neck deformity are features of RA. You can have pencil cup deformity, where you have a cup along with a pencil, seen in psoriasis, or you can have sacroiliitis, seen in ankylosing spondylitis. Ankylosing spondylitis, you will have fusion of the vertebrae, bamboo spine, and then you have something called as a gout, where you have red, hot, shiny skin along the first MTP. Great toe is gout till proved otherwise in an inflamed joint. It's very common in alcoholic intake and businessmen, because they eat non-veg and take alcohol. Whereas when there is a loss of sensory fibers and the joint is totally destroyed, can't be recognized, is Charcot's, usually seen in diabetes, mid-tarsal joints. Runner's fracture is a fracture of lower end fibula, very commonly asked nowadays. Then widening of the bony ends in a young child is rickets. Their bones will become cup-shaped, cupping, there is a splaying and there is a flaring. And when you give them calcium vitamin D, they have a white line of Frankel called as a healing ring. Whereas whitening is curvy, there is whitening around the metaphysis called as white line of Frankel, or there is a ring of epiphysis being white called as Wimberger ring sign. Whereas in rickets, you have only width increase. When you look at the different spines, remember that alternate white and dark band is rugged jersey spine, seen in CRF, chronic renal failure, more than osteopetrosis, bamboo-shaped spine, ankylosing spondylitis. Due to the weak bones, cord fish vertebra seen in osteoporosis. Osteoporosis is very, very commonly asked, or a bullet-shaped vertebra seen in achondroplasia. This is a disorder where you have enchondral ossification defect. And then you have ivory vertebra, means the vertebra looks white or the boundaries look thickened, called as picture frame vertebra, seen in a disorder called as Paget's, where even the skull has got sclerosis. When you amputate a limb and you want to replace it, the one done in a Western lifestyle is a sanglid ankle cushion heel, which do not allow to sit on the ground or walk on uneven grounds, called as a Sach foot, whereas the Indian variety made by Dr. P.K. Sethi is a Jaipur foot, which allow to walk barefoot and sit on the ground. This prolapse usually occurs at L4, L5 level, and whenever it occurs, the lower nerve root is compressed. L5 nerve root is the commonest compressed nerve root in the human body. And when there is a destruction of an area in the spine called as pars interarticularis, then this is called as a neck there's a collar in the neck of the dog called as spondylolysis, involving the L5 vertebra, and because of it, when one vertebra slips over the other, it's called as spondylolisthesis, commonly occurring between L5 S1. Mallet finger, I told you, is avulsion of extensor tendon of distal phalanx. Jersey finger is opposite to it, avulsion of flexor digitorum profundus from distal phalanx, which is treated by surgeries. Developmental dysplasia of hip, you have a shallow acetabulum and the hip will go supralateral, breaking the Shenton's arch. And when you look at to treat it, you give a Pavlik harness. When we look at Perthes disease, it's avascular necrosis of the femoral epiphysis 4 to 8 years of age. Classically painless. When you look at the slip of the epiphysis in relation to metaphysis, it's called as slipped capital femoral epiphysis. When you draw a line over the neck of femur, it normally cuts a part of epiphysis. If there's a slip, it won't. And in slip, remember, it's the metaphysis that moves. The epiphysis does not. This line is called as a Kleen's line. This sign is called as Truthoven sign. When you look at the pseudohypertrophy of the calf, this is classically seen in dystrophin gene mutation called as Duchenne's muscular dystrophy, whereas proximal muscle weakness, the patient climbs on himself, called as a Gaver's sign. So when you look at this image which came last year, this is short, webbed neck, low posterior hairline and restricted neck movements occurs because of the fusion of the cervical vertebra. Remember, congenital talipathic rhinovirus, one of the commonest congenital deformities. There is involvement of the talonavicular joint, TN, which is most resistant to the treatment. But overall, the talocalcaneonavicular complex is involved. At birth, you apply a cast. More than 10 years of age, you do triple arthrodesis, which involves talonavicular, that is TN, TC, talocalcaneal, and CC, calcaneocuboid joints. Remember, when there is a fracture in a child involving only one cortex, it's green stick fracture. And in a child, an anterolateral deformity of the leg is called as congenital pseudoarthrosis of the tibia. Remember, the lower end of radius deformed is a mid-lung deformity with a prominence of the lower end of ulna. And when there is a fusion of the radius and ulna, you will not have pronation supination, called as radio-ulnar synostosis. Remember these lines when you go for the exam on NEET, 18th April 2021. Remember, Ewing's is a radiosensitive bone tumor. Taylor's spinal brace is a brace for the entire torso, dorsolumbar region if there's a damage or there's an infection. Remember the image of Galeazzi fracture. Remember the image of patellar fracture. Remember, the calcification of a mass over the upper end femur is usually chondrosarcoma. Flexion, abduction, external rotation of a lower limb is a sign of anterior dislocation of hip. Flexion, adduction, internal rotation is a sign of posterior dislocation of hip. Remember, osteogenesis imperfecta is a collagen 1 defect. There are multiple fractures in it. Remember the winging of scapula, the image where the medial border of scapula becomes more prominent. Remember, the widening is seen in rickets. Remember, the ulnar nerve is behind the medial epicondyle. Remember, there is Klippel field syndrome image, fusion of the cervical vertebra. Osteosarcoma is metaphyseal with a growth extending beyond the cortex. Bone morphogenic proteins will do bone induction, osteoinduction. Pectoralis major is the adductor of the shoulder. Abductor, pollicis longus, goes at the base of the thumb. Medial end of clavicle ossifies beyond 25 years. The pedicle screws are put through the pedicle in the spine for fixation. Milwaukee brace is used for scoliosis. Bamboo spine is seen in ankylosing spondylitis. Remember, RA is a young female with bilateral hand pain with morning stiffness. In osteoporosis diagnosis, you do a DEXA scan, you do an X-ray, you do the biochemistry markers, you do the quantitative CT scan. Remember, low dose PTH is responsible for the stimulation of the bone growth. Remember, at the elbow, capitulum can be marked and you have to pick this up. Remember, sequestrum can be discharged to the sinuses of cloacae. Remember, the infection of phelon or the pulse space is because of Staph aureus. Remember, TB hip starts in acetabulum. GCT can go till the joint. Remember, you apply a cast with weight bearing at the soft callus stage. Remember, L4, L5 discs will compress the L5 nerve root. Fluorosis will cause the whitening of the skeleton called as sclerosis. In DDEH, you give the von Rosen splint. Remember, radioulnar synostosis, the pronation and the supination is lost. Remember, Colles fracture will have dorsal angulation. Carpal tunnel syndrome, Durkin's test, the direct compression test, is very specific. In scoliosis, you do forward flexion to assess whether it's a structural or an idiopathic or a postural scoliosis. Remember lateral condyle humerus. There will be lateral part of trochlea undergoing AVN, called the fishtail deformity. Remember the abduction, external rotation of the lower limb. Even if the flexion is not mentioned, anterior dislocation of the hip is seen. Remember outer 1/3, the meniscus is repaired. In hyperostosis of the skeleton, something called as a Forestier's disease or dish should come in your mind. Remember the indications of spine surgery are increasing deficit, no improvement, or there is a bowel bladder involvement. Remember the ring sequestrum is seen around the pin tract and external fixator. Remember decurvance disease involves the thumb, abductor pollicis longus and extensor pollicis brevis. Cobb's angle is for scoliosis. Remember codfish vertebra is compression of the vertebra and osteoporosis. GCT will have a giant cell and mononuclear cells. The mononuclear cells are the malignant variant. Remember bisphosphonates are drug of choice for osteoporosis. Pulled elbow occurs because of radial head subluxation in a child. Remember the ossification on the wrist. Remember the Popeye is a bicipital rupture and the biceps tendon will bulge on the lateral aspect of the elbow. Remember osteoarthritis will involve the DIP, the PIP and the first carpometacarpal joint. RA will have a swan neck deformity. Remember the action of the lumbricals causing claw hand if there is a paralysis, and remember if there is a femoral shaft fracture, there is breathlessness or rashes, think about pulmonary embolism. When you go for your exams, this rapid fire will help you remember last 2-year questions which have been asked. Thank you. These are 36 minutes and 28 seconds. These are the lines and the images which can change your perception to orthopedics. If you were thinking about leaving this subject, this video is for you. If you were thinking about revising this subject, this video is for you. If you are thinking about scoring well in orthopedics, this video is for you. I was reading these lines which I want to share with you. Courage is a weapon of a fearless, of an achiever. Doubt is a dress of coward. You have to take a decision where you want to finish today. Every day, decide what is at stake. Your dream is just the next step. 9 more days to go. Everything that you wanted to go right can go wrong at this time. But trust me, if you have worked hard and you maintain your calm, you can just play an innings like Gilchrist in 2007 World Cup. In spite of not performing in the entire tournament, he came out with a breathtaking shot and the entire innings in the finals against Sri Lanka, which actually turned out to be the match-winning, in fact, the trophy-winning innings by any player. Very often this happens. You get a chance and you behave extraordinary. 18th April, my friends, I, as a student, just wish that may you hold your calm and give your best. Because that is what you should always remember. We have been told this, that karam kar, phal ki ichha mat kar. And like every video of mine, I would just like to finish it the same way. तेरी किस्मत दा लिखा तेरे तो कोई खो नहीं सकता, तू श्रम करा चल बंदे, जो उसकी मेहर हुई तुझे वो भी मिल जाएगा जो तेरा हो नहीं सकता. All the very best. Thank you very much.